to our presentation. The Simcoe Muskoka District Health Unit is pleased to present the 2024 Nutritious Food Basket Survey and Monitoring Food Affordability results for Simcoe Muskoka. My name is Vanessa Hurley. I am a public health nutritionist and registered dietitian at the health unit, and monitoring food affordability in our region is an annual project of mine. Thank you so much for your interest in this very important topic, and we hope you enjoy the presentation. The presentation will focus on two key topics: monitoring local food affordability and household food insecurity. We'll look at rates in Simcoe Muskoka, rates in Ontario, impacts on health in our communities, effective solutions, Simcoe Muskoka District Health Unit's actions, and some successes we've seen in our communities. Since 1998, local Ontario public health agencies have been mandated by the Ministry of Health and Long-Term Care to assess and report on the health of local populations and describe the existence and impact of health inequities, as well as monitor food affordability at a local level using the Nutritious Food Basket Survey tool. The Ontario Nutritious Food Basket is a standardized survey tool used by Ontario's local public health associations to monitor both accessibility and affordability of foods by relating the cost of food to individual and family incomes. The basket measures the cost of basic eating that represents current Canadian nutrition recommendations and average food purchasing patterns. It is not a tool to guide daily nutrition intake or purchasing decisions. The basket includes 61 food items based on the most current Canada's Food Guide. There are more plant-based items, less meat, more whole grains, less sugar and salt. The basket does not include highly processed, ready-to-eat foods, convenient snack foods, foods for religious, cultural, celebratory, or special dietary requirements or preferences, infant food or formula, takeout or restaurant food, personal care items, or cleaning supplies, which are often purchased at grocery stores. Most nutritious food basket food items are whole, unprocessed foods that must be prepared. The basket is a very modest estimate of food costs. It is not meant to be used as a budgeting tool. It assumes people have the benefit of the knowledge, skills, time, and equipment needed to access, prepare, and store the foods on the list. In reality, this is not the case for many residents. Canada's Food Guide and the Ontario Nutritious Food Basket are non-inclusive for all religious and cultural groups, and they do not acknowledge traditional Indigenous foods and food procurement practices. The Simcoe Muskoka District Health Unit recognized this as a limitation of data collection. The monthly cost of a nutritious food basket for a family of 4 in 2024 is $1,302.77 for Simcoe and Muskoka, $1,260.64 for Simcoe County, $1,365.50 for Muskoka. The reference family of 4 includes 2 adults aged 31 to 50 years and 2 children aged 14 to 18 years and 4 to 8 years. The monthly cost of a nutritious food basket for an individual in 2024 is $452.83 for Simcoe and Muskoka, $437.71 for Simcoe County, $472.26 for Muskoka. Reporting only the cost of food suggests that the Ontario Nutritious Food Basket is recommended as a healthy way of eating. The basket is only an example of the foods that can be purchased to determine benchmark cost of eating. Additionally, reporting only the cost of food suggests that the data may be used as a budgeting tool by individuals and families and implies that the cost of food is the cause of household food insecurity. It is important to always present the cost of food within the context of income to communicate that incomes are inadequate for many residents. We will present this information in the slides to come. For residents, the inability to purchase food is not because food prices are too high. An exception would be in northern and remote areas of Ontario and in some First Nations communities, where the high cost of food, along with insufficient incomes, does contribute to food insecurity. To monitor food affordability, the monthly cost of food and rent in our region are collected and compared to 13 household income scenarios. As mentioned earlier, it is important to always present the cost of food within the context of income to communicate that incomes are inadequate for many residents. For income data, incomes were calculated considering the highest possible entitlements available to residents based on income tax data and assuming residents had filed their taxes and had applied for all applicable tax benefits and credits. These amounts represent the maximum amount individuals receive. For food data, we get food data by using the Nutritious Food Basket Survey tool. In May 2024, the prices of 61 food items were collected from 14 grocery stores from all around our region. The data was pooled to derive an average cost for individual food items, which were then adjusted based on gender and age to calculate the monthly cost of food. For rent data, monthly rent data is collected from local sources for Simcoe County and Muskoka from the Canadian Mortgage and Housing Ontario Market Rental Report. An average was calculated for bachelor, 1, 2, and 3-bedroom rental units, and inflation was factored in. Once we combine income data with food and rental costs, we can form scenarios that represent people living with low incomes in our region. In your opinion, do you think food is affordable for those living in Simcoe, Muskoka? The answer is no. Food, along with rent, is far from affordable for many living in Simcoe, Muskoka. Results from the Nutritious Food Basket Survey consistently paint a picture year after year that some residents in Simcoe, Muskoka, particularly those with low incomes from social assistance or minimum wage work, grapple with the harsh reality of insufficient funds for nutritious food, rent, and other basic needs. For them, the costs often consume the majority, if not all, of their income. These 13 scenarios show that for many Simcoe, Muskoka residents living with low income, it is impossible for them to afford the cost of nutritious food and rent, let alone have money for other basic needs. For some, for example, a single-person household, they do not have enough to cover their basic needs. The family of 4 with a medium income after tax is the comparator. Year after year, we see the same pattern. Things must change. People in our region are experiencing household food insecurity, which is the inadequate or insecure access to food due to financial constraints. They do not have enough money for food. Household food insecurity is one of the many markers of material deprivation that are directly linked to poverty. Material deprivation is the lack of access to the items and activities necessary for a basic standard of living, including low income, limited assets, debt, and other indicators of social and economic disadvantage. The experience of food insecurity can range from concerns about running out of food before there is money to buy more, to the inability to afford a balanced diet, to going hungry, missing meals, and in extreme cases, not eating for whole days because of a lack of food and money for food. Food insecurity is not the same as hunger. Hunger is the physical sensation of discomfort or pain experienced by an individual when they have not eaten enough, whereas food insecurity is a lack of access to enough safe, nutritious, culturally acceptable food to support normal growth and development and a healthy life. Food insecurity is the result of the economic and social conditions that influence a household's ability to access or buy food. Although hunger can result from severe food insecurity, an important distinction is that hunger can be temporarily addressed through food interventions, whereas only economic interventions that increase household income can address household food insecurity. Having sufficient income to access a nutritious, adequate, and culturally acceptable diet for all people is essential to creating strong and thriving individuals, families, and communities. In 2024, Dietitians of Canada released their position statement on household food insecurity in Canada, which addresses the cause of household food insecurity, the serious health implications, and the groups disproportionately affected, and the need for economic policies that increase income. For families living in poverty, meeting basic needs is a daily struggle. Limited financial resources hinder access to essentials like clothing, transportation, medications, and specialized dietary needs. Families with young children experience additional pressure due to their kids' rapid growth, leading to constant clothing needs that strain their already tight budgets. Transportation is another critical yet often overlooked need. It's not just a convenience. It's essential for accessing grocery stores, medical appointments, workplaces, and other vital services. Without transportation, there is also a greater risk of social isolation. This issue is particularly pronounced in rural areas where options can be limited or non-existent. Children in poverty often miss out on extracurricular activities like sports, arts, and community programs. While these may seem non-essential, they are vital for children's development, fostering peer connections, skill building, and physical activity. 1 in 3 households, or 30.7%, in Simcoe, Muskoka experienced some level of household food insecurity in 2023, compared with 1 in 4, or 24.2%, of Ontario households. Food insecurity in 2023 was significantly higher both locally and provincially compared to the previous 4 years. The difficult reality is evident. Food insecurity is worsening locally. Food insecurity remains a large and persistent problem in Canada. The estimates for 2023 are the highest in almost 20 years of monitoring food insecurity in Canada. In Ontario, food insecurity has increased in children ages 1 to 17 and continues to. In 2023, almost 1 in 3 of Ontario children are living in food insecure households. Household food insecurity data, Nutritious food basket, and monitoring food affordability data for Simcoe, Muskoka, and Simcoe County can be found on our Health Stats website under Economic Characteristics. This new infographic can be downloaded from our website. It highlights the cost of eating well in our region, along with 4 of the 13 scenarios mentioned earlier that are used to show that food and rent is unaffordable for many of our residents. In Canada, in 2022, a staggering 69.9% of households relying on social assistance programs as their primary source of income, specifically provincial welfare and disability programs, reported experiencing food insecurity. Despite being recipients of what can be considered the income support programs of last resort, the majority of these households find themselves grappling with the inability to afford essential items, including food. Alarmingly, half of these households fall under the category of severely food insecure, indicating they face the most extreme levels of deprivation, placing them at heightened risk for adverse health outcomes. Similarly, the statistics in Ontario show over 60% of households with social assistance as a main source of income are food insecure. Having a job doesn't guarantee sufficient income. While the incidence of food insecurity among households reliant on employment income may seem relatively low, they constitute the majority of food insecure households in Canada, reflecting the predominant means of income for most Canadians. In 2022, 60.2% of food insecure households cited their primary source of income as wages, salaries, or self-employment. It's essential to recognize that merely having a job does not guarantee sufficient income to meet basic needs. Workers most likely to report food insecurity encompass those engaged in low-wage, short-term, or precarious positions, racialized workers, individuals juggling multiple jobs, and those supporting multiple dependents on a single income. Similarly, in Ontario, over 50% of food insecure households are reliant on wages, salaries, and self-employment as their main source of income. For additional data on household food insecurity, locally, provincially, and nationally, feel free to check out some of these links. Household food insecurity has serious consequences for an individual's physical and mental health. Food insecurity is a problem of inadequate income. that cannot be solved by providing charitable food. However, we have a long history of food charity in Canada, which has created a large network of nonprofit food providers. But there has unfortunately not been a reduction in food insecurity rates. Food charity programs can provide temporary food relief for some people, but are not available or accessible for all individuals and families for several reasons, such as geographical distance, operational issues, transportation, and issues with stigma or personal dignity. Messages that promote food charity as the solution to food insecurity may lessen government's efforts to take action on important income and policy improvements that will put more money in people's pockets. Proof is a leading research program in Canada that looks at household food insecurity and effective income solutions. Their most recent report on household food insecurity states, food insecurity has been a long-standing problem in Canada, and it has now gotten worse. More action to reconcile wages, social assistance, and other income supports with the actual cost of living is needed to meaningfully address household food insecurity. Addressing household food insecurity and poverty requires a whole community approach to guide actions and find solutions that put more money in people's pockets and take pressure off of the family budget. Economic policies that ensure adequate household income are essential to reduce food insecurity. So how can we tackle food insecurity? As mentioned, income and policy supports are needed. Some federal and provincial strategies include social assistance rates to match real living costs indexed to inflation, basic income, affordable, attainable housing, lower taxes for those living with low income, jobs with livable wages, regular hours and benefits, and improvements to the Canada Child Benefit. Changes require political and public support to progress. What are some local, community, and municipal strategies that can address household food insecurity? Examples include subsidizing public programs and services, becoming a living wage employer, advocating for increased attainable housing, advocating for increased social assistance rates, advocating for a guaranteed basic income, supporting free income tax filing clinics, and supporting coalitions actively combating poverty and household food insecurity. For more information on collaborative initiatives to reduce household food insecurity in your community, please reach out to us. Many communities in our area are already taking action. Some activities include working towards developing poverty reduction strategies, implementation of subsidized recreation access, adoption of a living wage, sending letters to the provincial and federal government in support of improved incomes, providing transit subsidies or free transit for our youth and seniors, supporting and promoting automatic tax filing and free low-cost tax clinics, and supporting poverty reduction events. What is the Chronic Disease Prevention Program currently doing to reduce household food insecurity in Simcoe, Muskoka? We are annually monitoring food affordability and household food insecurity rates, raising awareness about household food insecurity as a serious public health issue in Simcoe, Muskoka. We are working with local decision makers and influencers, municipalities, task groups, food councils, coalitions, and other community organizations on solutions that support income adequacy and reduce household food insecurity. Working with their communities on actions that can decrease poverty and household food insecurity and can increase personal and community resilience. There are opportunities at all levels of government to make positive changes, and we are working more consciously with our partners to make positive changes in our communities. What can you do to reduce household food insecurity rates in our area? Learn more about poverty and household food insecurity. Share your learning and raise awareness of the issue by talking about it with family, friends, and colleagues. Speak out for change. As individuals and community groups, we can advocate to the provincial and federal government for policy changes that will lead to effective income solutions. Taking action can be simple. In addition to talking with friends, family, and colleagues about the issue, send a letter. Reach out to us if you'd like a personalized or a local letter. Have your say in the next election by voting. Identify opportunities to collaborate with others and get involved in poverty or food insecurity work in your communities. We welcome you to connect and collaborate, and reach out to us to get started on working on long-lasting solutions that target inadequate income. Feel free to check out these links for additional information. Here are some possible questions for further reflection and discussion at your organization. We encourage you to share the recording and get the conversation going. Thank you for taking the time to listen to our presentation. Household food insecurity rates locally are at an all-time high. We cannot afford to do nothing. Things must change.